The stress we place on our body usually goes unnoticed until something goes wrong. Every day when performing normal work duties, wear and tear or microtrauma occurs in our muscles, tendons, nerves, and tendon sheaths. The intensity and duration of the task, as well as the time we give our bodies to recover, plays a key role in our day-to-day health. Even well-conditioned athletes can experience problems with parts of the body used over and over and subjected to awkward position or excessive force. No matter who you are or how strong you may be, the way we use and move our bodies throughout the day can, over time, add up to injuries we call cumulative trauma disorders. Our bodies are like any other mechanical device. Over time, moving parts can wear out. For example, tennis players suffer from one of the most common forms of tendinitis called tennis elbow. But a tennis player is rarely injured in a single game. The problem takes months, even years, to develop. That's what cumulative means, occurring gradually over time, accumulating day by day. The upper body, arms, and lower back are especially susceptible to microtrauma and cumulative stress. The main focus is on office ergonomics and the prevention of CTDs. We'll explain to you what CTDs are, how they occur, and the methods you can take to correct and protect yourself from them. First, cumulative trauma disorders go by various other names. Some of the more common names are repetitive motion injury, or RMI, repetitive stress injury, or RSI, soft tissue injury, and overuse injury. We refer to these injuries as cumulative trauma disorders. CTDs are injuries that affect the musculoskeletal system. The musculoskeletal system is made up of bones, ligaments, muscles, tendons, and nerves. Let's look at the function of each component to get an understanding of their role in our daily movements. First are the bones, which provide the necessary framework and support for our bodies. Next are ligaments, which connect bone to bone, forming joints. Ligaments hold our joints tight and are injured when extreme stress is placed on them. If excessive strain is placed on a ligament, it will stretch. When you stretch a ligament, it does not spring back into shape. Instead, it stays stretched, leaving you with an unstable joint. Most ligament injuries are traumatic in nature. That is, they occur from one specific event. Ligament injuries most commonly occur in the shoulder, knee, and back. Next, you have muscles. Muscles are very strong fibers that give us force and strength. When a muscle is flexed or contracted, it generates the force required to perform a multitude of tasks. Tendons attach muscle to bone. They transfer the forces created by our muscles. Tendons are the pulleys in our body and are covered by a sheath filled with a Teflon-type substance called synovial fluid. The purpose of this fluid is to provide lubrication to the tendon as it rides through the tendon sheath. When a muscle is contracted, it pulls on the tendon, which is attached to the bone. The result is movement. Tendons, unlike ligaments, don't stretch. Instead, if subjected to repeated stress, they can fray and wear out. Last, you have nerves. Nerves carry electrical impulses from the brain to the muscles. These pulses tell the muscles to contract and how much force to use when contracting. While there are multiple types of cumulative trauma disorders, we can group them into three main categories: tendon disorders, nerve disorders, and neurovascular disorders. Let's look at each group, starting with tendon disorders. The most common tendon disorder is tendinitis. Tendinitis is a form of tendon inflammation that occurs when a muscle and tendon unit is repeatedly tensed. With further exertion, some of the fibers can actually fray or tear apart. The tendon becomes thickened, bumpy, and irregular. This increases friction in and around the tendon, causing inflammation or swelling. Tennis elbow or lateral epicondylitis is one of the most common types of tendinitis seen in the office environment. The elbow is particularly vulnerable to tendinitis because of the large role it plays each time we move our hands and fingers. The next major form of CTDs are nerve disorders. Nerve CTDs occur when repeated or sustained work activities expose the nerves to pressure. This pressure, or compression, can occur from two sources, internal and external. Internal compression occurs when structures within the body cut off the blood supply to nerves. This is most frequently caused by awkward or static postures. With external compression, stimuli from a source outside the body interferes with blood flow to the nerve. One example of external compression would be resting your forearm on a hard, sharp edge of a work surface or even using a pair of scissors. Nerve disorders are caused by inflammation or swelling induced by various occupational or non-occupational causes, which also cut off valuable blood supply to the nerves. When blood supply to a nerve is reduced by either static postures or mechanical compression, the result is numbness and tingling to the nerve sensors. The most widely talked about nerve disorder is carpal tunnel syndrome. The carpal tunnel is located between the wrist and hand. Tendons used when flexing the fingers, the median nerve, and blood vessels pass through the carpal tunnel. These structures are held in place by the transverse ligament. All of these structures are in an area about the size of a dime. If swelling occurs from occupational and/or non-occupational factors within the already cramped carpal tunnel, the median nerve may be pinched. When this occurs, normal blood flow to the median nerve is compromised. The result is numbness and tingling to the thumb, index, middle, and half of the ring finger. Swelling within the carpal tunnel can be the result of jobs that combine high repetition, awkward postures, and high force. Common non-occupational risk factors of carpal tunnel syndrome include diabetes, fluid retention, and hormonal changes. Another major CTD is neurovascular disorders. These CTDs involve both the nerves and adjacent blood vessels. One of the most common conditions of this type is thoracic outlet syndrome. This involves the shoulder and upper arm. Thoracic outlet syndrome is a general term for compression of the nerves and blood vessels between the neck and shoulder. These blood vessels are compressed as a result of various activities or postures that include frequent reaching above shoulder level, reaching behind the torso, or working with the shoulders in a static, rounded position. The good news is that cumulative trauma disorders do not have to occur in the office environment. CTDs are not caused by one specific event. Instead, they occur insidiously over time as a result of performing multiple risk factors, often simultaneously. The first step in prevention is to identify the risk factors that are associated with the development of CTDs. The risk factors that are associated with the development of cumulative trauma disorders in the office environment include repetition, awkward postures, forceful exertions, mechanical nerve compression, and poor physical condition. Other factors that can lead to discomfort include improper lighting and high ambient noise. Let's look at each of these factors in greater detail. First, let's discuss repetition. It's common for computer operators to perform high repetitions during data input. In fact, someone that types 70 words per minute performs 2,100 exertions per hour. The more repetitive the task, the more rapid and frequent the muscle contracts. Muscles required to contract at a high velocity develop less tension than when contracting at a slower velocity for the same load. Therefore, Tasks requiring high rates of repetition require more muscle effort and consequently more time for recovery than less repetitive tasks. Tasks with high repetition rates can become sources of trauma even when the required forces are minimal. Repetitive work without adequate recovery time overstresses the tendons of the hand and wrist and will, over time, lead to a CTD. If you perform a highly repetitive task, take short micro breaks of 60 to 90 seconds every 10 to 15 minutes. During these breaks, flex your fingers, then drop your hands to the side and shake them out. This will help to return valuable blood flow to the muscles, tendons, and nerves. The next risk factor is awkward postures. Awkward postures are one of the leading causes for CTD injuries in the office environment. This is especially true when the posture is static. Let's look at what happens within a muscle during a static muscle contraction. Static effort is one of the largest problems you face in the office environment. Static effort can be defined as a prolonged state of muscle contraction. When muscles remain in a state of heightened tension, the result is increased muscle fatigue and decreased blood flow. Blood is what supplies the muscles, tendons, and nerves with nutrients. During static effort, the blood is depleted. The muscle receives fuel from stored energy, creating a high accumulation of waste products within the muscle. Blood is also cut off from tendons and nerves. The result is increased muscle fatigue and soreness. Static postures of the head and neck stress the shoulders and can create symptoms in the arm and hand. Static arm and hand postures can also be found when reaching for the mouse or other pointing device. Remember, when performing a task in a static posture, valuable blood flow is being shut off to muscles and tendons. This will result in fatigue, soreness, and eventual injury. When sitting, try to keep your torso over your waist. Slight deviations out of this neutral posture are generally acceptable so long as extreme bending is not performed on a regular basis or held for a prolonged period of time. To understand this better, let's look at someone standing in a neutral posture. The back is properly aligned with a good inward curve at the neck or cervical region. The ear is over the shoulder. Next is an outward curve in the thoracic spine or between the shoulder blades, and an inward curve in the low back or lumbar region. This is the natural S-curve of the spine. When you're in this neutral posture, your spine can adequately support the weight and forces placed on the body. Now let's look at someone in a good posture while sitting at a computer. Notice that the neutral posture of the spine in a seated position is the same as when standing. The back is properly aligned with a good inward curve at the neck or cervical region. Notice the ear is over the shoulder. Next is an outward curve between the shoulder blades or thoracic region, and another inward curve in the low back or lumbar region. The knees should be parallel or slightly higher than the hip, and the feet should be flat on the floor or on a footrest. The upper arm should hang down naturally from the shoulder and be in line with the torso. There should be a 90-degree angle between the upper and lower arms with the elbows close to the torso. This is neutral posture of the hands, not extended, flexed, or deviated to either side. The next risk factor that is associated with the development of cumulative trauma disorders in the office environment is forceful exertions. The pinch and pencil grips are the two most common grips used in the office environment. At least 4 times more force is required to pinch an object versus grasping the same object using a power grip. When using a pen or pencil with a small barrel, increased force is required to hold the object. When performing frequent writing tasks, choose a writing device with a larger barrel. The amount of force required to perform tasks are greatly multiplied when performed in an awkward posture. Consider the hand and arm posture of this person. The arm is reaching overhead, and the wrist is in an awkward posture. A pinch grip is used to grasp and lift the file out of the drawer. The force required to perform each of these tasks adds up to forceful exertion. Forceful exertions can also occur when removing books from desktop organizers while seated. Forceful exertions can also occur when computer operators often use more force than what is required to perform data input. If you hear someone typing before you see them, chances are they're using more force than what is required to do the job. The next risk factor of cumulative trauma disorders is mechanical nerve compression, or direct pressure on nerves. This occurs when the sharp edge of a desk or other object comes into contact with nerves. This compression temporarily cuts off the blood supply to the nerve and causes a numbness and tingling sensation at the fingertips. Another example of mechanical compression is using your hand in a hammer-like fashion. The most common areas for mechanical compression are the hand and the fingers, the elbow, and the knee. The next major risk factor associated with the development of CTDs in the office environment is poor physical conditioning. If you are more than 10% over your ideal body weight, the amount of stress placed on the body is increased. Blood flow and circulation may also be affected. We know that when you are physically fit, oxygen-rich blood flows through the veins and arteries, supplying your muscles and tendons with the nutrients they need to recover from the stress we place on them. Remember, blood flow is what keeps our body and tissues healthy. Start a regular exercise routine. You'll feel better, have more energy, and be healthier. Be sure to consult with your healthcare provider before starting any exercise program. In some offices, improper lighting can be an issue. Precise work requires significantly higher light levels than does computer work. With improper lighting, glare is the issue which causes the highest amount of complaints. There are two types of glare. Direct glare occurs when a light is shining directly into your eyes. Indirect glare, often referred to as reflective glare, occurs when a light source is behind the monitor. Improper lighting leads to awkward head and neck postures. Let's take another look at the risk factors associated with CTDs in the office environment and show you ways to neutralize these factors. It's important to emphasize the preventive measures that you can take in your office environment. Take a look at the tasks you perform at work and at home. Identify the risk factors performed on a daily basis and determine if there is a better way to do the job. Look at your posture and see if you can get into a more natural or neutral posture. Also, determine if your muscles are performing work in a static position and see if you can reposition yourself to eliminate or neutralize the posture. Remember, if you are working in an awkward posture, you are exerting a higher amount of force than what is required to perform the same task in a neutral posture. Non-neutral wrist postures increase pressure within the carpal tunnel, decrease grip strength, and increases the force required to perform tasks. Remember, CTDs do not occur from one specific event. They happen gradually over time due to a combination of risk factors, especially if performed simultaneously. Remember, we need to allow our bodies time to recover from the previous task before stressing it with a new task. If we allow enough recovery time within our daily work tasks, our muscles and tendons will receive the blood flow necessary to remain healthy. If you're performing a repetitious job, stop occasionally and take a micro break. Micro breaks are 60 to 90-second periods when you should put down the object you're holding or stop the tasks you're doing and shake out your hands. This will help provide the recovery time needed to get the blood flowing back to your tissues. This is not a time for a cigarette break. Cigarettes rob the blood of the much-needed oxygen. If you find yourself leaning on the edge of a work surface or other hard object, look for ways to pad the surface. This will help combat mechanical nerve compression. Don't use your hand as a hammer. It will not take this abuse for long without sustaining an injury. When operating a computer, remember these simple tips. Position your neck upright. Ears should be over the shoulders. This may require you to place the monitor on a support and to use a device to hold your source document. If you wear bifocals, it's important to maintain proper head and neck posture. Ears should be over the shoulder when viewing the screen. This may require you to lower the height of the monitor to the desk surface. The recommended distance for your monitor from your eyes is 18 to 24 inches. The screen should be positioned so that your head and neck are in a neutral posture with your ears over the shoulders. If you use a source document, it should be at the same height and distance away as the monitor. Relax your shoulders and keep your elbows close to your torso. Forearms should be parallel with the floor. Hands and wrists should be in a neutral posture and supported on a padded rest. If you use a mouse, get it as close to the torso as possible and use it on the same plane as the keyboard. Hips should be back in the chair, and the chair should have some sort of lumbar support. Some chairs have this support built in. If not, use a lumbar support cushion or even a rolled-up towel. Keep the knees equal to or slightly higher than the hips, and your feet flat on a footrest or flat on the floor. Again, being physically fit plays an important role. You'll feel much healthier and have energy once the workday is over. It's also important to stretch out during the day, especially after performing work in static or awkward positions. Cumulative trauma disorders do not have to occur in the office environment. Remember the primary risk factors of posture, force, and repetition when you return to your workstation. See if there are ways you can neutralize the effects your job places on your body at work and at home. If you have a computer at home, proper setup is equally important. We need to give our bodies the time required to recover from normal work duties. By identifying and eliminating poor work postures, you will greatly reduce your chances of suffering from a painful cumulative trauma disorder.